Dr. Michael Hendrickson is a professor of pathology at the Stanford University Medical School and director of Surgical Pathology Laboratory. Hendrickson shares his insights on the topic, which affects many worldwide every day. That topic is cancer. Cancer is not only a disease, rather it's related to other diseases that arise from different abnormal cell growth. Cancer is a very complex disease that has many cells that behave in different uncontrolled forms and spread throughout your body. Hendrickson, throughout his career, has done extensive research and clinical experience that have teach biometric components that define cancer. He also explains the continuous disease is most difficult to treat. In the form of cell growth, cancer occurs in the body and begins to grow uncontrollably due to mutation. These mutations disrupt the normal regular cell growth that causes divided abnormalities, forms tumors. Making observations on the size of the margins in the spectrum it involves determines what happens and what is going to be performed on the patient. For example, a neobiopsy, which is put onto a tray, is diagnosed. The therapeutic process of breast cancer would be the core tissue. That tissue is taken out about 10 inches, which goes through a number of processes that are used on a glass slide that is stained up for many different tests. The nucleus in cytoplasm is to look at the basic pattern that is shown for the diagnosis. Genetic mutations are the foundation of cancer, which is usually a genetic mutation of DNA cells. These mutations can be inherited, or more commonly, they occur due to environmental factors such as exposure to toxins, radiation, or viruses, or random errors during cell division that can occur. Mutations are the cell's main growth and how they adapt and become cancerous to the genetic code. This small cellular housekeeping machinery, mutations are scattered across the body. Whatever is going into these mutations is a very genetic process that wasn't confined when the cells were being formed. Dr. Hendrickson highlighted oncogenes, which are versions of normal genes that drive the cancer cells, and the tumor-suppressed genes, which are normally act to prevent cancer. When the tumor is suppressed, the inactivated oncogene is activated, the cancer develops. Tumors are not just abnormal cells, but they're surrounded by environmental included blood vessels. The shape of the cells arranged in the various cells, organized tissue, are arranged by the scaffolding of the body. The cancer spreads through the original location, the primary location of the tumor, which other parts of the body known as metastasis. This is a dangerous aspect of cancer that can multiply organs and become harder to treat. The cell becomes apparent that it is not a homogeneous structure. It is enabled in the matrix of the jelly and cytoplasm and is surrounded by the cell membrane that delimits the cell from other cells or from the outside world. A single cell organism and so forth is created by the tumor. Dr. Hendrickson highlighted various treatments such as surgery, radiation, and targeted therapy. These treatments aid to remove and destroy the growth of cancer and prevent measures like lifestyle changes and avoiding carcinogens like tobacco and alcohol. Detect through screenings and emphasize through cancer research the survival rates. Radiation therapy is performed before or after surgery. Performed before surgery means the mass is too big and in difficult places for the surgeon to remove it and help shrink it down more. Performed after surgery is to help diminish any remaining cancer cells left behind and prevent further spreading throughout the body. Surgery is performed to remove the tumor or prevent further growth. It helps relieve pain and pressure from the patient, as well as further expecting them to do tests and responses to the treatments on the biopsy. These biopsies confirm and diagnose and make sure there isn't any odd behaviors from the cells before they start treatment. Hendrickson says cancer prevention involves strategies aiming to reduce the risk of developing cancer, such as healthy lifestyle, which is healthy diet, exercise, avoiding tobacco, limiting alcohol, UV exposure, and vaccines. Melanoma and lung cancer are two top contributors from UV exposure and alcohol tobacco. Hendrickson has focused for many years on creating medical achievements that focus on early prevention and making it more treatable and manageable for patients. Although not all of cancers can be prevented and can avoid lifestyle changes, but medical intervention and vaccines and some common preventions and strategies to help prevent it further. Hendrickson gave us the inner workings on what cancer is in describing the cell's growth and most complex, diverse groups of diseases of cancer that is just uncontrollable growth. He made sure to emphasize throughout his career it's a daunting disease, and due to prevention, achievements and medical treatments have been significantly to improve in patients, and he stresses the adopting approach of creating a new lifestyle and healthy living for regular screenings.